this first one here, I don't know if you remember, I was talking about it. This would be something that you might see in like a pediatric setting, most likely. It's like a chamber where you can control, like maybe there's like 30 mils of antibiotic or something that you can, yeah, that's how much you can administer. So it's like very like set, like controlled. I don't see this very often anymore on the adult health setting. I used to do this when I'll be like getting a medication ready and I'll be telling the family member, this is like back in Taiwan, it's like, okay, watch this, when it's finished, come get me. Because we don't have a call-eye system, it's like back in the old days, and we don't have pump. The only patient that gets pumped is like people getting like a vitamin or something. So that's why we need this. But nowadays we do pump, so you probably won't see this unless you're in like a very specialty kind of setting. Okay, so I just pass this around. You can just take a look at it and what it looks like. If you ever have to use that, just get someone else that used it before to kind of guide you through it and help you through it. So don't stress over it, but you might see something like this in pediatric setting. Okay, and then we will just demonstrate. So I have, I need to give promethazine 6.25, clindamycin 600 milligrams, and then I'm going to compare this to my MAR. I hope the one that you have on your EHR is correct, but this one, when I was like checking it this morning, noticed that the pharmacy didn't enter it correctly. It's like it says clindamycin 300 milligrams, but when the order says 600 milligrams, so I'm gonna call pharmacy and have them like, hey, can you like fix this? And then if the nurse is the one doing it, transcribing the order, we need to correct it and fix it. So let's say we're gonna fix it. Normally I would take this paper out and fix it, but since we're pandemic, so I don't want to take it out, put it in next year. So we corrected it, simulated, corrected it, so 600 milligrams IV push. And if there's any questions that you need clarification from the provider, this is when you SBAR to the provider and get it clarified. And so we get that clarified, we're going to administer 600 milligram IV piggyback, okay? So that's done, and I'm just gonna set this here. So I've verified my order, and then my MAR is verified. And I also look, make sure that my patient is not allergic to anything. Look here, no drug allergy, perfect. Sounds good. And now I'm going to go ahead and look for my medication on the checklist. So on your checklist, I have equipment, IV medication bag. So here I have my clindamycin, and it says 600 milligram IV and 50 ml solution. I think, did any of you have a chance to calculate like how many drops per minute? I think you did
on the practice quiz.
Yeah. Okay. So I mean on this one, so it's you know, I think this morning they calculated it. You can do that later when we finish demonstrating. It's like I think like 13 drops per minute. Like so basically 6 drops per 30 seconds, 3 drops per 15 kind of thing. Paige is gonna figure it out. No, not really. It's okay. It's like Friday afternoons. My brain is bad. Don't ask me this math question. That brain hurts. That's what my son says to me all the time. My brain hurts. Stop asking me questions. Okay. So I have this here. We're gonna say we calculated it. Everything is good. So I have my medication. And next, I need my secondary tubing. I have my secondary tubing here. Okay. And our drop factor is 15. So, you know, that's kind of how we we calculated with the drop factor, how many mils and things like that, infusion rate. To find out the infusion rate, usually the pharmacist at the St. David Hospital would already put it on the bag, so it makes it really easy. But as a nurse, you also want to like verify that it's not an appropriate infusion rate, because there should be a range, like you should infuse it not faster than this rate. So that's when clinical pharmacology can be very useful, or your drug guide. Any of the drug guide. I like clinical pharmacology because it's like right there on the computer. I know where to click. It makes it faster, so you can like look it up and see, make sure that they put it in correctly. That's part of your prep when we start doing medication, IV medication. That's part of your prep work. If your patient is also on clindamycin, you need to find out how fast can I infuse this? Is the rate correctly? Because it should be saying on the MAR, like how many mils per hour. That's like via pump. And your job is to make sure that that rate is actually appropriate according to the clinical pharmacology or your drug guide. Good? Okay. So I have this and I checked my expiration date. It's good, not expired. Okay, so I got my tubing and I have my label. Okay. And the tubing, IV tubings are good for 96 hours, SN Davis, okay? And a different hospital might have different policy, maybe 3 days, but most of the time it's 4 days.
Is it different if you're doing blood?
Blood is, I change the tubing every unit. If you give him blood.
Okay.
I mean, some people, like, they use the same tubing for the 2 different units, but to me, that's not good practice. I change tubing. Every unit of blood, I change tubing. Because I didn't actually compare the 2 units are actually compatible. So I change tubing every unit that I give. Yeah. Good question. You're like thinking far ahead.
We had the maternity hemorrhage sham yesterday, and there's the blood component. We haven't done that part yet, so I just wasn't sure.
Yeah, I mean the hemorrhage one, I'm not sure. That would be a Murphy question because
She said 2. Okay.
Yeah, I think there's a policy that says that. But for me, my patients usually is not bleeding out. Like for patients that hemorrhaging out, their just hemoglobin is a little low, so I have the time to like change the tubing every unit. But yeah, I kind of have to change, check the policy as well.
I would feel better if you had to do it every time, just because.
Yeah, I just feel better just because, I don't know. I want to do it the safer way, not the fastest way. But if the policy says that and you're covered by the policy, then you can go with whatever policy says. Yeah. Good question. I like how you link maternity and adult health all together too, so good job. Almost ate a flush, okay? Bunch of them here. And alcohol swab, got it here. Clean gloves, yes. Then I have my sterile cap. This is what we call male-female cap. And as you're doing it, you should have one at your bedside. Just, raise your hand or something if you have a question. So this white one is what you need to attach to the tubing, at the end of the tubing, and I'll show you how I do that. The blue one is just trash. The blue one is just basically keep the white one sterile. Okay, this is what we call, I don't know why we call it that way, but because like the computer, maybe like male-female cap. Okay, secondary tubing, I already did that. Calculator, I have all of you here, you all have calculator. Paper, I have pen, paper, yes, I'm good. All right, so now I'm gonna identify the data. So I'm given antibiotics. What kind of data would I need?
White blood cells.
Good job.
Like other signs of febrile symptoms.
Yeah, and our patient is admitted for pneumonia, and then the patient also has CHF. Chest X-ray shows that pneumonia she has, and then she had a culture sensitivity done. So we have appropriate reason to give this antibiotic to this patient. And you also could check liver function, even creatinine, to make sure that everything is good for the patient to process this medication safely, right? Okay, so we're good here. And then we'll already check the patient's not allergic to any medication or any tape, and when we go into the room, we'll also ask the patient, are you allergic to anything, okay? And any contraindication, like allergies and compatibility, we can look at that too. And so that way you can verify that patient can receive normal saline, and normal saline is comparable with this medication. So that's something that you can look it up too ahead of time, okay? Yeah, and then it says here, check the detail about how to get medication. So when you're doing your checkoff, this will be something that you need to look it up, know how to find that information, and you'll have that information a couple of days before the checkoff. Go ahead and look it up. You know the information. You know where to find that information. You can use your phone to show me your drug that you've looked up, or you can use clinical pharmacology. You can pull up it on the computer. Go ahead and have EHR pull up, and go ahead and clinical pharmacology pull it up, whatever you want to use. Have that ready, and when you're ready to do the checkoff, then that won't count against you for your time. That makes sense? But you need to show me how you get to that information. And you don't have to memorize it. I don't want you to memorize those information because I can't remember that, and it would be unfair for me to expect you to remember that. But at least understand it and know how to find that information. You can show it to me. Here's the information. This is how I find it. And as far as calculation, you can work it out ahead of time. You cannot bring your scratch paper with you, but you know the answer, right? And you just have to like, show me, this is how I come up with the answer. You already know the correct answer, right? Yeah, does that make sense? Yeah, good. Alrighty, okay. And then you can introduce yourself to Miss Odell. Miss Odell, I'm your student nurse. I'm here to give you antibiotic. Here's how it works. It's gonna treat, you know, whatever it's gonna treat. And then you wanna look at the IV site. It looks good. I don't see any infiltration or phlebitis. So look at that. And as I do my IV push, I can check and make sure that it's actually good. Right, I don't have to like put gloves on and check it again. So I can just look at it, visually inspect, and then when I'm ready to do my push, I can assess the IV site, okay? All right, now I'm gonna wash my hands. Okay, I have my equipment collected. And then I'm gonna go to my next page, which is check IV medication label for expiration date. Okay, I will do that. So I'm gonna pick it up and then look and see I have the correct medication, and I'm gonna check again, you know, because when I gather it from the medication room, now I have it with me. I'm gonna check it again, make sure I have the right drug. So I have clindamycin, and it's IV piggyback every 6 hours. I have, this is here, it's correct. Check the expiration date. It is somewhere, see if I can find it. Sometimes I can find it easily, sometimes I cannot. Oh, here. So it's not expired. I'm good here. And what else would you check besides expiration date and the correct medication?
Make sure it looks okay, like it's not cloudy or there's no particles.
Yeah. So this is all clear fluid. Sometimes antibiotic could be a light kind of yellow color. That's fine. But you shouldn't have like bloody color like this one, like Kool-Aid color. And you shouldn't have anything floating in there, right? So it should be nice and clear. Maybe a little pale yellow, but that should be all it is. Depends on what you're given, okay? All right, so that's all good. There's no leaking. You can lightly squeeze it. There's no leaking here. And all good. And then I'm gonna stop here. Actually, we're gonna prepare our IV push first because I have a Phenergan to give, so I don't want us to be infusing this one, and in the middle I'm gonna push the Phenergan if I can avoid it. It could be that you infuse the antibiotic and the patient all of a sudden get a little nauseous. Then yeah, you have to like stop the infusion and then do your IV push. But if you know it ahead of time, you're gonna do it anyway. So do the push, it's safer. Okay, so we're gonna prepare this push first, and then we'll do this part. Okay, so you don't need gloves. For that, I have my swatches, and then I think my morning class kind of got a little confused about this is your filter needle. It might look different at the hospital, so you just have to like read it because it actually says filter on here. And then this is actually a blunt tip needle. I think it says blunt fill needle, so make sure that you pick up the right one. Out of way, I think they got it all flipped. But and because my Phenergan comes in an infill. So I need to use a filter needle to draw it up, right? You know, just in case there's any kind of like little glass broken in there. So I have this, I have my medication. So I'm gonna now pick up this medication and compare it to my MAR. So I have promethazine, and the concentration is 25 milligram per mil. So I have it here. So I'm gonna compare this with my MAR. Promethazine 6.25, I will push now. It's not been given, so I'm gonna go ahead and give it, okay? So that's good. And then I have my syringe. I have 3 choices. Which syringe should I have? Because it's 25 milligrams per mil. This is 1, this is 10, this is 3.
Do the 1.
Yeah, good answer. I'm gonna agree with you. All right, so you pick it up, open it, you know, in a sterile kit, and now I'm gonna attach it to my filter needle, right? Okay. I'm gonna attach that, so that's good. Okay, next I'm going to scan, everything scanned in, right? In the hospital, you have to like log in 3 times. Scan your patient's armband, verify. They're allergic to any medication, tape, or anything like that. Patient says no, he's good. So I'm going to clean the neck part. Charge this. And then I'm going to get an open alcohol pad. Go ahead and take it away from you, away from everybody else. Charge this in the shot container. Go ahead and put this on this dirty surface. Leave it. Okay. I'm going to get my medication. You don't need air because this is an ampoule, right? Okay. The tricky part is how can I see medication with this glare? I was like, I couldn't see. Okay, and just have the input. Yep. And then you can get like extras. I think this morning I got way too much extras. A little too much. Good enough. Take it out. If it didn't have enough, you can re-enter it because it's just an ampoule. And now I'm gonna recap this needle. Carefully. Okay, now I have air bubble at the end of this syringe. Get rid of that. I did a better job this time. Because this morning as I got way too much because I can't see. Alright, so now my surface that I can see and push it up to where I need it. I have 0.25, so good. And then now I'm gonna transfer this into my 10 ml syringe. Okay? And then I'll need to dilute it with saline. I check, make sure my Phenergan is compatible with promethazine or Phenergan. So I'm gonna put this tube into this syringe. So I first need to switch my needle. Because I don't want any glass into my patient's vein, right? And this can go in right here. Done. Okay. Now I'm going to transfer everything into here. I'll take this off, save my cap. So I can use that. Make sure you create enough space for your medication. Okay, I have my medication in there. And then you can use the same needle to get your saline, but if you're worried about you might have contaminated, feel free to get another needle. Yeah, it's better to be safe than sorry, right? And now you can put this needle onto your saline. Just be careful, don't touch anything that's supposed to be sterile, which is like this part, and this part. So you have so many parts that you have to make sure they are sterile. Put this on, and then you're gonna pull back to get enough space. And you know, if all possible, try not to touch the plunger because that's where it needs to be sterile, right? Now I'm gonna put